and welcome to another episode of Healthy Talks. My name is Julie, and today we are honored to be with our next guest, who's Dr. Brown from Doc Now. Hi, Dr. Brown, how are you doing today?
Hey, Julie. I'm doing well today, thanks. How are you?
I'm good, thank you. Thank you so much for taking the time out of your busy schedule to meet with us. I really hope that you are going to enjoy this episode as much as we are, and that our listeners take some insightful points away for the day.
Thanks so much for having me.
So tell me, Dr. Brown, how did your early life experiences shape your decision to enter the healthcare field?
Okay, sure. So, um, I grew up in Port Elizabeth, the friendly city, now known affectionately as GQ. Um, so I was the youngest daughter of a single mom. She was a widow, and she was, sole provider for the family kind of a thing. And my grandfather lived with us at that stage. So my grandfather, Ishaq Akoldin, was quite the marvel. So he had about 6 strokes roundabout, but he managed to recover completely from each and every one. And that made me quite curious about how some people would be completely debilitated, unable to, live their daily lives after just a single event or single stroke, whereas
Yes.
he just completely recovered. So that intersection between genetics, environmental factors, personal resilience, and the effect on health as we know it was very, very interesting to me.
Mm.
And then I was fortunate enough to have some really nice GPs where I was from. So Dr. Adam and Dr. Muglia. So they were really great and explained a lot of things to me, and they always encouraged my curiosity about medicine and health conditions, which takes a lot of patience. So
Mhm.
great stuff from them. And then I had an aunt, Latifa. So she was a social worker, and basically volunteering with her and being in a workplace, she helped me to get a good idea of people's actual backgrounds and how that affects
Mm.
healthcare and access and how all of that interacts to make the picture of health, right? And then, of course, my mom, Salama, did her very best to support me in all of this. And, after lots of hard work and a couple of detours, here we are
Yes.
today.
And here you are today.
Yeah.
Amazing. And in your opinion, what are some of the biggest challenges facing the healthcare field right now?
Okay. So there are quite a few, of course, but I think one that maybe people don't know so much about is the fact that there's so much unemployment in healthcare
Mm.
because we're, under the impression that we need more doctors, so therefore you should train more and, we should always have jobs, right? That's the idea. But unfortunately, budget cuts to healthcare has affected the state system so much that these trained systems that we already have are even
Mm.
under more pressure now. And, hospitals and clinics just can't afford to hire more people. And, some people have had to be let go. So new doctors often struggling to get work, having to compete even for those temporary locum positions. So that is quite a challenge that our field is facing.
Yeah, I think the staffing issue is a worldwide problem at the moment, but yeah, it's unemployment in healthcare. That's an interesting
Yeah.
take on it. But you do online consultations, and tell me, what are the main benefits of online medical consultations for patients in rural or underserved areas?
Okay, so basically the way I started out doing these virtual consultations was because I was working in a rural area myself. So I was in Ottosdal in the northwest,
Mm-hmm.
and then I was going to be leaving. So I felt quite bad about leaving my patients behind. But also I wasn't able to stay there. So I wanted to, have them be able to access me if needed. And then that's basically where this all came from. So set up some virtual consultations so that they would be able to access a doctor, even if there wasn't one in the town at
Mm.
the time, kind of a thing. Yeah. So the benefits in general is accessibility. So wherever you are,
Accessibility.
whenever it is, you're able to see someone if you have a medical need.
Definitely. I don't think people realize how important accessibility is throughout. like especially in rural areas, like it's not something easy, and this is making it a lot more easier for them.
No, definitely. So, it takes so much out of a person's day and time that when they have to go and see a doctor, if you're living outside of town, you have to pay for
Yes.
transport, you can't do your work. And, it leads to this decrease in adherence to treatment, and all of these other things. And then that leads to complications of these diseases. So,
Mm,
fortunately, we've been able to see a increase in adherence with our patients just because it is easier to get the
yeah,
test. Yeah.
that's great. And can you guide us through the process of booking and participating in an online consultation with Dr. Nan, including what patients should expect?
Sure thing. Okay, so let's see if I can share my screen. Okay, right. I think it's working. Okay, how's that?
There we go.
Okay, perfect. So first things first, we visit the website. So we're on www.drnow.co.za. You have a look at this lovely design we've put together, right?
Beautiful.
Okay, and then you read through the website, we explain everything, things that we can give advice on.
Mm-hmm.
Okay, and then that's how it works, some testimonials, a little bit of background about each of our doctors. Okay, and then important is to have a look through the frequently asked questions also. So you can see all of these things. Okay. And then importantly, you go through, things that we can help you with. If you don't,
Mm-hmm.
and then if once you've determined now, okay, I could actually use the service, it could be helpful for me, then you'll click on one of the booking buttons. So yeah, we'll book an online consultation at the top. Yeah.
Mm.
And here you are. Today's the 22nd, so you're on there now. And then you can select a slot, right? So you pick your time and your date that works for you. Then you're filling in all of your details, which we will then be able to see. Then you
Mm-hmm.
complete your payment. Then after that, you'll receive an email and an SMS with your appointment details, your doctor's information, and the link for your video call, right? And then when the time comes, you and your doctor join the call. Your doctor takes a medical history from you. You'll be guided through a self-examination,
Mm.
and asked to send through any necessary documents. So that can be things like previous results of tests that you've had done, your old prescriptions, just anything that we might need to support. Right. And then your doctor's going to decide on the necessary treatment and
Mm.
investigations, all of those kinds of things. And then you will receive your forms, your prescription, your sick note, all of that via email, within at the most an hour after your consultation,
Yes.
depending on how complicated your situation was.
That's amazing. I think I like the most the booking the time, because when you phone a doctor, you're not really sure what time you're going to get, and now you do know.
Yep, and it's for certain. Sometimes we've all been there. We booked the appointment, and then it's an hour later, but we're still in
Yes.
the waiting room. Yeah, none of these problems with our booking system, thankfully.
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go to. They've got everything you need to run a pro show, including 35 or more AI powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthyTalks15. The code is HealthyTalks15. Plus, check out podallies.com for a done for you podcasting experience, complete with website, social media, and editing. Start now and let's launch your podcast together.
It's a very user-friendly system. It's very well done.
Thank you.
But what are some of the common technical issues that arise during these online consultations, and how do you address these challenges to ensure a smooth experience?
So initially, when we were just starting out, there were quite a few issues with phone settings, laptop settings, and people struggling to get around that. Um, so we went a bit of an extreme route. So the software available wasn't really doing what we wanted. So
Mm.
um, that led to, me reaching out to Yasin Hamdullah. So he's a former Google London software engineer, right?
Okay.
So then you were like, oh, this really isn't working. I have to use so many products just to, get a good experience for me and for the patient. And then we went to the other end and we developed an entire platform just for Dr. Now to work on. And, I'm happy to say that over time we've managed to solve all of our issues. And, a few other things along the way for other practices
Yes.
and businesses. So that's been great. Yeah. But if patients do have still any issues that
Mm.
come up, which, is something that does happen, um, we're usually able to sort it out with a quick call and a little bit of, technical support, which doesn't take too long.
That's great.
Yeah.
And what were some of the significant challenges you encountered when transitioning to online medical consultations, and how did you overcome them?
Okay. So, like I said, the software things was such a lot.
Yes.
So, yeah. So, firstly, getting the bookings for the calendar, and then being able to accept payments, and then being able to do video calls. You had to like combine a whole bunch of things and try
Yes.
and make them work together nicely, which was not always the easiest for me at least, right? And then overcoming that, we developed reserveit.co.za, and that has been really great. And with the help of Nabil Joseph and Dr. Ilan van der Skeef, we've been able to develop it more and make it more suitable for other people as well.
Okay. And how do you foresee telehealth evolving in the realm of mental health care in the future?
Okay, so good question. All right, so during COVID, and technically COVID is still around, but
Yes.
with the height of the pandemic, we noted a lot of, an increase in the need for mental health services, right? So, and fortunately, many psychiatrists and psychologists saw the need and adapted really quickly, started offering their patients the virtual consultations, the telephonic consultations, and that proved so valuable, really. Okay, and I think it still has great value, now
Yes.
and in the future. It improves access for patients because a depressed person doesn't really have that energy, and it takes a lot for them to
Mm.
get up and get out, make that booking, especially after phone someone, all of those kinds of things. So I think it's really improved access to care for patients, adherence to treatment, and I think in future for Dr. Now specifically, what we want to do is partner with psychologists, psychiatrists, life coaches, even to
Mm.
provide our patients with a truly holistic approach to treatment.
And how does Doctor Now ensure patient privacy and data security during these online consultations, and what measures are in place to protect sensitive information?
Okay, so we are POPIA compliant, right? And then we encrypt all our patient data. We don't store it with or share it with any third parties. So yeah, that's what we're doing. And only your doctor has your access to your
Mm.
information. So that's great.
I think that is a concern for lots of like the older generation doing online consultation is the data privacy and not taking your information, giving it to a
Yeah,
telemarketer or anything like that.
basically. Yeah, nice and safe, confidential. We take that very seriously.
That's great to hear. And what are your plans for expanding Doctor Now, and how do you envision this growth impacting the communities you serve?
Okay, so Reserve It is a big part of how I plan to expand the services of Dr. Now. So, with our junior doctors struggling to find work, what we'd like to do is to assist them to make their own practices with minimal
Mm.
overhead and cost to themselves, and also the ability to live anywhere and yet serve all the communities of South Africa. Because I think that's a little bit magical, right? So,
Yes.
um, what we want is for it to be super easy, right? For doctors to be able to set this up and for patients to be able to trust that those doctors are registered with HPCSA, up to date, those kinds of things, and that they can trust their advice, right? In the long term, what we hope that this will achieve is taking a bit of the burden off of our state sector and also our private sector by giving patients more affordable options in terms of healthcare and easily accessible options as well. So, in the middle of the night, somebody coming to the ER with, something that maybe could have been addressed earlier, but the person just didn't have the time to go in. Yeah, so that contributes to the burden of work and, the burden of patients in a facility. So hopefully we'll be able to take care of that, and then our communities will be able to be healthier.
Oh, that's great. I don't think it will be a hope. I think you will be able to do. I think you've done already so much, achieved so many milestones. So I think that is definitely going to be in your future.
Thank you so much, Julie.
Well, Dr. Brown, thank you so much for joining us today. I really do appreciate you taking the time. And it was interesting to see the doctor side of telehealth on our show. So thank you so much for joining.
Thank you so much for having me, Julie. It's been a pleasure.
Ah, fantastic. And to all our subscribers out there, remember to like, subscribe, and share. And we will also put the website for Dr. Now along with this podcast. Bye.
Bye.